Hello there, my name is Gant Maurer, and we're going to be discussing general herd health recommendations for a commercial cow-calf herd. And this presentation actually comes from our Master Cattleman program, and if you would like more information about Master Cattleman or even a beef cattle manual that is developed specifically for the Master Cattleman manual, please go to your local county extension office and the extension educator can help you do that. So what we're going to look at is like I said, discuss cow-calf herd health programs. And we want to think about what types of diseases we want to prevent, some of our parasite control. We're not going to talk too much about parasite control in this particular section. There's another section on the website to be able to do that. Of course, beef quality assurance is important, how we administer those vaccines and how we administer those drugs and handle those animals. And of course, our overall goal is animal well-being. And any time that we have animals in a confined setting, a confined system, whether it's in a chute, a small set of pens, we also need to think about human well-being. Our biggest hired hands or help is usually our family members, and oftentimes that's overlooked. So we also need to consider not only animal well-being, but human well-being as well as we're working with large animals in confined settings. Okay, so these we'll give you some general guidelines as an outline for creating your own herd health program. The idea is to focus on prevention. If we can prevent a disease, we can reduce the cost, and it's much cheaper to prevent a disease than it is to treat a disease. So that's kind of what we're focusing on today. And again, I already mentioned it. We're maximizing net return to the business unit, to your ranch. Okay, and we're going to do that by disease prevention rather than treating some of those diseases. And again, herd health is not a one-size-fits-all program. Okay, you really need to work very closely with your veterinarian. Okay, and they will take into consideration some housing. Is that a confined or a pasture situation? What kind of weather conditions are we looking at? And again, you may actually not have facilities to vaccinate your animals, but it may be better for you to actually deliver those animals to the veterinarian who has hopefully better facilities and help you work those calves at your veterinarian's facilities. Again, work closely with your veterinarian and develop that relationship with your veterinarian. Okay. Really, at its core, being a cow-calf operator or running a ranch is we want to convert forage, something that humans really cannot use, to beef. Okay? And our primary goal, or how we do that, is to deliver a live calf, and therefore protecting the calf to weaning, if we're going to sell that calf at weaning, or maybe possibly the next phase of production. And part of that is disease control. We need to keep that calf healthy while they're on the ranch, as well as once they leave the ranch of origin, whether the original producer retains ownership or they sell that calf and send it on down to a stalker or grower type situation. Okay, so we want to organize our herd health. Most typically, we do that by production cycle, meaning the production cycle actually begins once that calf hits the ground. Really, it begins before that calf hits the ground, but our records would really begin when that calf hits the ground. Some people can do it by time of year, especially if they don't have an actual calving season or breeding season. Maybe time of year would be more applicable. Okay. And again, these are just general guidelines, and work with your veterinarian to get a more specific type vaccination protocol for you, for your cows, your environment, and your area. Okay. So we're going to think about on our calf crop some things we can do pre-calving before that calf ever arrives or hits the ground. We want to make sure we have a good environment and nice facilities for that calf to be calved out in. Okay, do we have the proper equipment there? Is that equipment clean? Is it functioning? Is it sterile? If we need to help that cow or help that calf be pulled in some way, shape, or form. It's also a good idea to sit down and visit with our veterinarian and review our standard operating procedures for calving. What is the time that we need to wait before we come and interfere with that calving situation and help that mama cow out? And we talked about it in the body condition scoring section of these videos, but we need to manage that cow so they're in good body condition score so they can rebreed after calving. Some things we also need to think about is, do we have some quality frozen colostrum or even a colostrum replacement, a powder that we can buy available so we can get that colostrum into the calf extremely quickly. If something happens and the cow doesn't accept the calf, or the cow may die during calving, or whatever the situation may be, which occurs occasionally, we need to be prepared for those types of situations. Okay? So let's move on into the actual calving situation. What are some things that we would probably think about doing once that calf hits the ground? And again, this is probably going to be within 24 hours of when that calf hits the ground. After that, those calves are pretty feisty. We don't want to run them all over the pasture to try to catch those calves. So we want to do this fairly quickly after birth. Okay, if you're able to do it, we want to individually identify that calf. We may tag that calf with the dam's ear tag number or another method that you may have that works for your ranch. Birth score, what's the vitality of that calf? We can assign a score to it and say, oh, that calf was very vigorous at birth or not so vigorous. Okay, and we want to step back. One thing I like to do is once I see a calf born, just take time out. Don't mess with that calf. Let him get up and see if he starts to milk. And of course, that first milk, the colostrum, is going to be very important to the life of that calf. Getting those antibodies and that passive transfer from the cow to the calf is extremely important. So kind of just step back and let that process happen. Again, we will probably record the birth of that calf. It would be nice to know which cow is calved so we know who we're waiting on to calve and who we're not waiting on. Possibly we would dip the navels with some iodine just to seal that up from any type of infection. Castrating at birth is very successful. You can either knife castrate at this time or use a band. The earlier we castrate the calf, the better it is for the calf throughout its lifetime. The longer we wait to castrate that animal, the well-being of that animal is really in jeopardy the older they get. Okay, dehorning, we're probably not going to be too concerned about dehorning at this particular time. We may give a tetanus because we are castrating those calves. And if at all possible, we may gather that calf very quickly and weigh them with a set of scales, a handheld scales, and we can lift that calf up to record a birth weight on that animal as well. As we move out through the production cycle, what we consider branding time, or 2 to 4 months of age. This is traditionally the time where you would see the ranches would actually rope the calf and drag the calf to a fire for branding and vaccination. And really, this is the branding of a calf can be a very low stress way to work calves if you have the ability to handle a horse and rope. Okay, so again, if we didn't already individually identify those animals, we're going to want to match them up in a pen. This may mean pulling those calves off for several hours and then turning them back in with the cows to see how they match up and milk. Again, this is a good time to castrate if we didn't do it in the pasture at birth. It really needs to happen now. Again, we can dehorn if that's something that we need to do, if it's not a polled type animal. And again, a Clostridial blackleg, really for the whole state of Oklahoma, is a no-brainer at this period of time. And really, that calf at some point in its life, in its young life, before 2 years of age, really needs 2 rounds of a blackleg shot. And a good parasite control program will be needed. Again, depending on location and season, if you have a spring calving cow herd, that parasite control program will become fairly important. We may think about bangs vaccinating our heifers. If we're going to keep that heifer back, we'll probably want to bangs vaccinate her, or if we intend to sell her, as a breeding heifer. Again, lepto or pink eye and any respiratory disease is a good time to do that. And again, if we castrate, another good time to give a tetanus vaccine during this branding or the early first 3 to 4 months of that calf's age. As we get older into weaning, okay, for a spring calving cow herd, this weaning time would be September or October, something along those lines. For a fall calving cow herd, we would probably wean an early wean in April. We may keep those calves on into the summer and keep them and wean them later on into the summer. Okay. Again, another Clostridial blackleg vaccine, 4 or 5-way viral respiratory vaccine. Even if we did that at branding, we're probably gonna revac those calves at weaning. Possible lepto, and again a parasite control program if need be, or if your veterinarian sees fit. It would be very nice to be able to weigh all of our calves at weaning and record those weights if at all possible. Okay, and we're also going to body condition score and preg check our cows at that time. We'll palpate those calves. You could also use one of the serum tests, the blood test, where we could tail bleed those calves and get a pregnancy test from that cow at that time. Again, if we didn't earlier, if we want to make some marketing decisions to sell replacement heifers, working with our veterinarian to bangs vaccinate that heifer may be important. OSU also offers the Oklahoma Quality Beef Network VAC 45 program. You may want to enroll your animals in that and market your weaned calves at that time as part of the OQBN type program. Okay. Moving on into replacement heifers, we want to monitor growth of those replacement heifers. Again, at the yearling age, we want to make sure they're developing where they're in good body condition score, where you can breed those heifers and have a successful breed up on those heifers. We'll probably, prior to breeding, want to do a 4 or 5-way viral respiratory vaccine again. Definitely another lepto type vaccine and a blackleg vaccine would probably be recommended throughout the state of Oklahoma. All right. Again, Vibrio, another must for any breeding female, as well as individual ID if she hasn't already. Most females that are going to be kept and marketed as a replacement heifer or kept in the herd as a replacement heifer will already have those records on them and already have those individual IDs. Processing the adult cow herd. Again, a lot of times, if at all possible, the recommendation now would be pre-breeding to vaccinate those calves if at all possible. Okay, 30 to 60 days pre-breeding. So that means basically as soon as they're done calving, can we pull those cows in to vaccinate those animals? Again, work with your veterinarian to determine when the best time is for you to vaccinate those cows. Again, we're going to use a 4 or 5-way respiratory disease type vaccine, a good parasite control program, lepto, Vibrio. And a lot of times you can buy the combination vaccines and really limit the number of vaccines that you're actually giving to that cow. Okay? At that time, whenever we're doing it, we would like to get a body condition score. Let's look and see how those cows are moving around. Are they going to be able to make it another year out on the range, out on our pasture? Okay, what's our udder placement? Do we have problems with the udder? Is that calf going to be able to suck and gain based on her udder placement? Okay. The other thing is anaplasmosis control within our herd. Again, this will be working with your veterinarian. We've seen more anaplasmosis throughout Oklahoma and Kansas, as it at one point in time was kind of eastern Oklahoma, but it started to move west and pretty far west, quite frankly. So work with your veterinarian, whether that's an anaplas vaccine, which can be fairly expensive, or a veterinary. He can write you a veterinary feed directive and put some sort of medicated CTC in your medicated mineral. And also, don't forget your bulls. We also, a lot of times, we'll put the bulls in the back pasture and not use them until that breeding season. Okay, prior to turning those bulls out with the cow, we want to do a breeding soundness exam, a BSE. So this means working with your veterinarian, taking that bull into the veterinarian to make sure that he is structurally sound, that the semen is high quality semen, and that he can breed your cows. Nothing could be more detrimental to your cow herd than to have a bull that can't get your cows bred. Okay, and then we've essentially skipped almost a whole production cycle because we didn't have that bull checked out. We want to keep that bull in moderate body condition score. We don't want that bull overly fat. We definitely don't want him too skinny. Okay, we don't want a real fat bull where he can't be mobile. He can't get around those cows, and he's more worried about laying in the shade rather than covering our females throughout the pasture. Again, we'll vaccinate that bull very similarly to how we'll vaccinate the cows. Okay, and oftentimes we can pull that bull in at the same time and vaccinate him. And again, use a solid parasite control program on that bull. 60 days pre-calving on all females. Again, a good herd health program, it does require to be reviewed annually, again with your veterinarian. And any time that we can prevent a disease, it's cheaper than treating a disease. Vaccines are relatively cheap versus antibiotics. Okay, we want a good nutrition program, good body condition score at all stages throughout the production cycle. And really, we need to keep good records of all products used. Make sure we write down the withdrawal times of those products so we can protect ourselves in case a residue violation comes up. Of course, we can't sell an animal for slaughter if they are still within that withdrawal time of a vaccination or antibiotic used. Okay, and make sure you observe label directions. And there may be a consideration for use of a modified live vaccine on pregnant animals. It may be something to think about. Really, if you treat those animals 60 days pre-breeding and then again 30 days pre-breeding, a lot of these modified live vaccines have guarantees they will not prevent an abortion, and we haven't seen very many of those and haven't seen much data on some of those modified live vaccines. Again, it's up to you and your veterinarian, and work with your veterinarian to put together the best herd health program that fits both you and your environment. All right. Thank you very much.